Hello, I'm Jeremy Fernandez and welcome to our special live stream to answer your questions about the coronavirus. We're doing this Q&A every week and there are a lot of really good questions coming in from our viewers. So if you have questions for us, please pop them in the box below and we'll get to as many of them as possible. Now, joining us today on the live stream is Dr. Vyom Sharma, a GP from Melbourne and health commentator as well. Also with us is the ABC's national medical reporter, Sophie. Scott, welcome to both of you. Good to see you.
Hey, Jeremy.
Good to be seen.
Now, we're taking your questions on coronavirus, so as I say, leave your comments and questions in the boxes below and we'll get to as many as we can. Now, we've had a lot of questions this week, again, about isolation. It seems to be confusing a lot of people. The rules do vary from state to state, but the very first question, as we do every week, Dr. Sharma, I want to ask you, how are we doing with that curve and flattening the curve?
Yeah, so I guess what we can say very cautiously is that the curve is showing the first signs of flattening. And the reason you see me inflecting my voice a little is that we need to be very cautious about it. But really, to put into perspective, it seems that the number of new daily cases is flattening out and may even be going down. The reason we need to be cautious is because of what's caused this flattening. So we know for a fact that we've got all these travel bans, which means the main source of new cases, which is from people coming from overseas, that's going down. The real question is what's happening out there in the broader community. We hadn't been testing the broader community as widely before. We're starting to now, and we are getting some good news, but we'll get some better data in a week or two. But it's looking okay for now.
Sophie, the signs are promising at this early stage of the flattening, aren't they?
That's right. Look, we've gone from about an increase of 25 to 30% each day down to now below 10%, even below 5% in the last few days. So the trend is definitely going the right way. I think, like Dr. Sharma is right, that the authorities are cautiously optimistic. They don't want to get ahead of ourselves in the fact that what we're doing now is working and we need to keep doing it. And we're coming up for a big challenge, and that's this weekend, that's being Easter. So that's when the temptation is for people to do what they've done before, which is, get together with friends and celebrate in family. And we just can't do it this Easter. And so I think while there's a good cause for optimism with the curve and the cases, they don't want people to say in their minds, wow, we're going okay, it'll be all right if I do this or that, because the fact is it won't be. So that's the message that we're hearing.
There seems to be a bit of confusion and questioning about just how far people can stretch themselves in travelling this Easter, whether it's going to the coast or to the mountains to visit family. We'll get to that in a moment. But Sophie, there is a bit of scepticism I detect around our reporting of this. And this is a question from Harney Anderson off our Facebook page. There has been a lot of reporting around coronavirus, but in the last 40 days, in the same period that we've been kind of heading towards a shutdown, many more Australians have died of cancer, heart attacks, strokes, accidents, suicides and other causes. Why are we not reporting this? Is there a disproportionate reporting and attention to coronavirus here? What are your thoughts?
Look, I think we're dealing with something we've never dealt with before, well, at least in most of our lifetimes, which is a very contagious, potentially deadly, unpredictable virus that we don't have a vaccine for and we don't really have any treatments for. So that's what it puts it in and it's spreading around the world as well. So that's why there's so much attention on this virus. Yes, the questioner is right to say that there are these other things going on in the background, but they'll be there when coronavirus is hopefully finished and we move on to talk about something else. At the moment, because of the nature of what we're dealing with coronavirus, it has to take our attention, and the media has a really important role to play in making sure that people are getting the right information. So I don't resolve from our coverage of what we're doing. I think we are putting a lot of attention and focus on this, but if we don't, then that's when you get the misinformation and the myths and the people believing what they're seeing on social media. So I think for the short term at least, we need to keep the focus up and the coverage up to make sure people are getting the right information.
Dr. Sharma, misinformation and scepticism an issue as far as you're concerned?
It's a huge issue, and it's one of those things that we can be out of touch from if we're just in the medical field or on, say, Twitter and our social media bubbles. Essentially what's happened is because of, I think, quite a lag in communication, very late communication from the governments and authorities, there's been this vacuum of knowledge, and that's filled up with kind of denial and skepticism and active misinformation from people. I think subconsciously people are kind of anthropocizing almost kind of making a villain out of the situation and who's responsible for this. And so it's there's some active conspiracy theories, believe it or not, with 5G that are really important to battle. But then there's just simple misinformation about people saying that, oh, you don't need to wash your hands with soap, just water will do, and X type of masks will work and prevent transmission of diseases. So we need some really consistent messaging, and people shouldn't be afraid of repeating themselves, because we'll need to hear about 10 times before it really sinks in.
You bet. And that's partly what this Q&A is about, isn't it, Sophie, about sort of answering those questions over and over again, because there are many shapes in which confusion takes around this.
And look, the advice is changing, and that doesn't happen that often with public health messages. We know with most other things to do with public health, we know, for example, that smoking is really bad for you. It always has, it always will be. So that message is very consistent. The messaging around coronavirus has been changing and evolving as we learn more about it. But there's been some good initiatives in terms of getting information out in the last little while. The federal government's put out both an app, a WhatsApp group, and also an app that you can download. And so I highly recommend people to get both the WhatsApp number and also get the app, because they are updating it every day and quite regularly, and it's got really good information. And it also means that anything that you're particularly interested in, you can go on and look for a bit more detail about that. So while I think there was a bit of a lag early on, certainly with the public health campaigns, but now there's definitely much more information flowing, which is a good thing.
Okie dokie, let's get to some questions around the season that it is. It is the Easter weekend, of course, and we have a question here that we received through our ABC News website. Can my neighbourhood have an Easter egg hunt where residents leave all the treats on the doorstep for children, so they're not handing them out personally to them, and then small groups in pairs go around and collect these treats from other people's doorsteps as a way of getting around the physical distancing rules and regulations? Dr. Sharma, what's your view on that?
Well, I think I heard a bit of scepticism in your intonation there, Jeremy. I think you're right. I think we have to be blunt here. I don't think it's safe. So it's not just enough for humans to be spaced apart. The point is that this virus can transmit through fomites, that is to say, just objects on which droplets might land. So if we've got multiple kids coming up to doorsteps and they're touching, say, the receptacle that the Easter eggs are in, and they're going from kind of house to house, this is a significant risk. Now, we could argue for any amount of safeguards and, we'll clean the bowl and clean the plastic foil of the eggs and everything else. It's just too much of a risk to take. And I think people need to remember for Easter is that if we get this one right, if we can celebrate it without being in each other's faces, we're helping ensure that our family and many other families will enjoy many Easters together for the future. So I don't think it's wise to do this.
Sophie, there's been a bit of questioning about, over the past few weeks, we've seen a lot of people wondering about just how long the virus survives on any given surface. Is that continuing to evolve?
Look, it is. We know there's been some good studies showing how long it can survive on some surfaces. So what Dr. Sharma says is right. It's just not worth taking the risk for something like that, because we know it can survive on surfaces for quite a few hours. So it's just not worth the risk. And the thing is that I think with every activity that we take from now on until things settle down, we've got to weigh up the risk versus benefit. And with that, the Easter egg example that you gave, the risks are just not worth it, because you don't want to think that something that you did or your child did might have infected a neighbour or a resident, and then they became sick. So if you can do an Easter egg hunt in your own household or your own backyard, then go for it. But I think just this Easter anyway, we need to sort of reframe what we're able to do.
Sophie, here's another question on a related note around surfaces. If you have a cut or abrasion on your hand, does that increase the chances of contracting the disease if you touch an infected surface?
Well, that's interesting. I guess you would need to think whether there was some droplets getting into that cut. You'd need to find some way that it was actually going to become invasive. So I think it would be unlikely, but I guess it would be, a good idea if you do have any cuts or anything to be making sure that you're wearing, proper Band-Aids and bandages and not having exposed wounds at this point. But what do you think, Dr. Sharma?
Well, I think it's a really good question. It demonstrates the complexity. So if we just go by infection control principles, the skin is probably the biggest immune barrier there is. And so if that's breached, then by all means, that means that if droplets were to get in, that might be a risk. Now, there's other factors there too. For example, the SARS-CoV-2 virus loves to attach to parts of the body that has these ACE2 receptors. Now, are they at the specific site you've got the cut, and who knows? And are we going to run the trial on half the people with cuts and half the people without cuts and see who gets the infection? No. It's very sensible what you're saying. Cover the cut, take every precaution possible while we learn more about the virus.
Sticking with surfaces, Dr. Sharma, does steam cleaning have any effect on coronavirus?
Look, there is some evidence to suggest that very high amounts of heat can cause the virus to degrade, but yet again, there's so many variables with this steam cleaning. You know, what is the object you're cleaning, and what was the viral load, and you know, how hot was this steam? How long is it going to go on for the actual steaming process? There's far too many variables here for us to say that it's confidently going to eliminate the virus from whatever surface that you are cleaning. So, you know, this is one of those classic situations where, I'm giving a very long-winded answer to we don't know, and we should take all the precautions we can, mainly with hand washing and washing your face.
But with that also, Dr. Sharma, we know that if you use like disinfectant or a bleach or something like that, that will work. So I guess the thing is you should always be, steering yourself towards those treatments and those actions that we know do have an impact.
That's right, yeah. So
because the soap does break down the virus itself, doesn't it?
Correct. It breaks down the virus directly. It also competes with the virus to stick onto the surfaces of your hands. And not to mention the actual, if you're washing your hands with water, it physically flushes the virus out of the way as well. So we've really got to stick to the evidence-based, most reliable measures here, which is to wash your hand ideally with soap and water, if not alcohol-based sanitizers, 70% or more, and just do it very frequently. That's what's reliable. That's what's proven for now.
It's funny though, isn't it, Jeremy and Dr. Sharma, that people sort of want to complicate things, saying, should we use, this or steam cleaning or whatever, but actually in this instance, it's actually the basics that make the big difference, the old-fashioned, infection control of like regular hand washing really well that we know actually works. So we're not really looking for a magic bullet in that respect because we know that this is what's going to be effective.
The solutions are very, very simple, and we keep coming back to them over and over again. Wash your hands and don't touch your face. Dr. Sharma, you mentioned about washing your hands, and we got this question on whether the virus then can show up in sewers. I mean, does it survive that far down the pipeline? And could that be used to help test where an outbreak is happening in real time?
So absolutely, the virus has been shown to be present in faeces, and the plan is to perhaps use the presence of virus in sewage as a kind of survey. Can we use this to spot early outbreaks in certain places? Now, I'd argue that we need to have better systems to spot kind of outbreaks, but it might be a very useful way in which, kind of at a population level, we can track what's happening. Now, kind of the broader issue is that virus that's present in sewage and feces actually kind of viable? Is it actually likely to cause infection? Because just because you find the virus somewhere doesn't mean it's actually likely to cause an illness in someone. Is the virus active or inactive, so to speak? Is it actually present in enough kind of load or quantity that it's actually going to cause an infection? Those are the bigger questions. So I think when it comes to that, it's useful at a kind of statistical population level to understand what's going on. But it doesn't seem to be a major driver of infection at the moment.
Sophie, I want to come back to this question about isolation, which has a few people tied up in knots. Very simple one. Can we get a car service?
So you mean like something like Uber, or get a limousine, or?
It's not clear from this question, so let's entertain the possibilities here. So you either catch a ride, or you send your car in to get fixed.
Yeah. So I think, with the car, getting your car serviced, I think if you don't need to do it, then I would put it off. I've put getting my car serviced off because I don't think, unless I need it desperately at the moment, I think it's, again, the risk-benefit analysis, and I don't think, my car is fine. I don't really need to get it serviced at the moment, so I'm putting that off. On the other issue of getting a car service, like coming to pick you up, like an Uber or something like that, again, it's a risk. The advice is to sort of sit in the back seat of the car and to not, make sure you're disinfecting, washing your hands if you can when you get out. But again, it's still not, you're still going into an environment where you really don't know how well clean that environment is, and whether the person that you're getting the lift from might even have the virus and not know it. So it's again a bit of a risk. What do you think, Dr. Sharma, about those two things?
Look, yeah, the car servicing, if we're talking about, actually fixing up a car, my car is total trash and it probably is due service. And there's almost this kind of trade-off of, what do I really need the car for? And really, the reasons personally I think I would need the car is to take care of my family, who my father's actually quite frail and ill, and one would argue that I need to have an efficient, safe method of transportation. So yeah, it's one of those excellent kind of nuanced questions. There's so many kind of layers to, but anything that I can put off, I will put off very confidently. So I think that, kind of the guts of your answer is just spot on.
Sophie, another one here from Naeem Flamuri off Facebook. Naeem, thank you for your question. Is it safe to go for a jog, and will that increase the risk of transmitting the virus, either catching it or passing it on to someone else? And someone else asks, what is the risk trade-off for older people between staying at home without the exercise or going out and getting the exercise? Sophie?
Well, look, the health authorities have been pretty clear saying you can go out for a short period each day to exercise, but it's ideally by yourself, or if it's with somebody, then you do need to maintain that social distance of 1.5 metres apart. So they've been pretty clear on that. When it comes to older people, again, if you can, and look, my father-in-law, who I've spoken about before, is actually a really good example. He's in a retirement village, but they're not allowed to actually leave the premises, but there is a garden at the front of that property, and he's been sort of walking up and down, getting his sort of regular exercise every day to make sure that he is getting some exercise, but in a safe way. And so that's something that I think would be, good advice for us all, that even just you don't even need to leave your house to get exercise, but if you want to, a short period of exercise is fine, ideally by yourself or with someone, but making sure to keep a good, safe distance.
OK, Dr. Sharma, I'm going to add this little twist from another question we received. How far can you travel to exercise? This questioner says, my son loves mountain biking and would like to travel about half an hour to a mountain biking track. We love to hike. Can we travel 20 to 30 minutes to isolated hiking tracks?
This is one of those, how long's a piece of string kind of questions. So, no, but I think there's a lesson to be learned here, right? I mean, for example, that particular example we gave, can imagine a scenario where that person, the question asker's son could go along and mountain bike very safely and come back and pose virtually zero infection risk? It's possible, but what does that actually look like at a policy level if we say, we can do that? And it becomes a bit of a slippery slope. Well, if we can do that, why can't we do the next thing and the next thing? And there's always this kind of question format that I'm getting. Can I do X because it seems so safe? And I think we have to make our peace here that everything we're doing in terms of the restrictions, it probably is a bit of an overcorrection. And the point is that in the face of uncertainty, with a virus that's very new, when we don't know the risks, you're always either going to overcorrect or undercorrect. You can't get it right because that's the whole point. So, would I, at a broad policy level, on national TV say he can go do that? I don't think so. No, I think anything that's unnecessary, we have to be on the conservative side here. So if there's people, exercising in their front yards, then that's a good example of the kind of restrictions and limitations we need to put on ourselves.
Sophie, you've also got to entertain here the possibilities of all the things that could go wrong when you go mountain biking and hiking.
That's right. So, Dr. Sharma's given an example where it all goes fine and you come back and there's no problem. But the other side of the coin is you go mountain biking and you might have an accident, or you might, end up needing to call the ambulance and then, or get lost or something, unpredictable happens. So, again, you are looking at the risk versus benefits. And I think with questions like that, it's sort of people looking for the loopholes. And I think what we need to be thinking about is not looking for the loopholes at the moment, and just recognising that this is an extraordinary circumstance that we're in, and the more we can stick to the guidelines as broadly as possible, the better off, not only for ourselves but for the broader community. And the government is having to sort of tweak the guidelines as they go through. One thing that has come up as an issue is, can you visit your romantic partner if they don't live in the same house as you? Because this is an issue for a lot of people. They don't live with the person that they're having a relationship with. And so a lot of the authorities were sort of very strict, saying no, but then they've realised they've had to sort of backtrack a little bit on that, because you can't say to someone who's sort of going out with someone, you can't see that person for 3 months or 6 months or whatever it's going to be. So each state sort of slightly, pulled back a little bit from that, saying that, if you go and see your partner at their house, it sort of comes under that caring, going out for caring reasons. So, everyone's learning as we go, basically.
Dr. Sharma, I've got another search for a loophole right here for you. This question from a parent asking, will you get fined for driving around to try to get your kid to fall asleep in the car? I'm in Queensland, but I'm confident it's an Australia-wide problem. What do you think?
Yeah, I would not roll the dice on that. I'm trying to imagine this from the position of the police officer who pulls someone over, and how credulous that claim would actually sound to me as a police officer at 10 p.m. at night time. The loophole is the exact right word, and there may be some very legitimate reasons and very kind of appropriate motivations. It just does not translate at a policy level. Like, imagine if that was the green light that Scott Morrison announced at the press conference tomorrow. Like, what else would happen? So I'm going to say no, as brutal as it sounds. And
also the other thing, Jeremy, is it's not actually a very good effective technique for getting babies to sleep anyway. I found with my son, I would drive him around, and as soon as I pull into the garage, he'd wake up. So from a parenting point of view anyway, it's actually not that successful.
Now, another question here from Lara Jane via our Facebook channel. Lara, thank you for your question. Do you think these isolation rules will be relaxed soon? Someone else on our website asked, will all restrictions stop at once, or will we be allowed to congregate with, say, 4 people on one day, 10 people a month later, and so on? Sophie, how do you think this is going to gradually ease?
So, look, I think a lot of people are thinking about this. They're thinking about, given the good news we're getting about the figures, that they're thinking about the road out, which is the term the government's using. And the government's actually sort of got some experts doing modelling on this to look like what that road out could look like. I think it's too early to say, to be frank, what that would look like. But I think we'll know once we look at the data from the Australian population that have coronavirus, what that's looking like in terms of the numbers of people, the level of community transmission. What they've suggested is that we're more likely to see things like, it won't be like an Australia-wide lifting of restrictions, but you might say, for example, see some states or some territories or even some regions to say, okay, you know what, you've got a very low rate of transmission here or no transmission. We might be able to lift some of those restrictions. But the reality is if that doesn't work, then we're going to go back to restrictions. So I think it could be almost one step forward, one step back. But it's certainly on the minds of the authorities, which is a good thing, because I think it's on the minds of the people about what are the next steps. So that's something, it's an active discussion at the moment.
Dr. Sharma, this is something, as Sophie says, it's on a lot of people's minds, and it's difficult to communicate how we might take 1 step forward, 2 steps back, 3 steps forward.
Yeah, the thing people have to remember is it all depends on how this virus is transmitting, and we're waiting for feedback on that. So there's a lot of questions about when are these measures going to be relaxed, and what that's going to look like in reality. It depends almost entirely on what's going to happen with this curve, and very likely we are going to see, if there is any relaxation, a very graded relaxation. So I cannot imagine a circumstance where we will go from where we are now to let's have the NRL. It's going to be graded foot off the pedal in local ways. We'll see what the viral transmission is doing, and they will respond accordingly. You're not going to go from 0 to 100.
OK, let's move on to how testing is working, Dr. Sharma. You indicated before that we're ramping up testing in certain parts of the country. This questioner asks, does testing indicate the severity of the infection?
That's a good question. No, it does not actually tell us anything about the severity of the infection at all. So currently the testing tells us, has someone got the RNA, the kind of genetic code of the virus in them or not? Does not tell us how much there is. We think that the amount of the virus that you are exposed to says a lot about what the severity is. So we don't get that answer from tests. We are getting kind of predictors of how sick someone might be according to their age and other conditions they might have, and whether or not they're smokers, but that's about it. The tests don't tell us how sick you are.
Sophie, this question, what are antibody tests rather, and are they available in Australia?
So look, that is a good question. There's a lot of interest in antibody tests. So once someone's exposed to the virus, after about 5 or 6 days, the body starts to build up antibodies to the virus. And there are tests available that can identify those antibodies. So we do have those tests in Australia. They're not diagnostic tests, so you don't have those sort of tests to say, do I have it or not? You know, the great hope is that in the future, and this is something that's being actively looked at in Germany and the UK, is that there'll be an antibody test that you could have to see not only whether you've got the virus and how much of it, but also whether, you know, you have got over it as well and you develop some immunity to it. And there's this concept of an immunity passport, which would be you could have the antibody test and then you could say, I've got the antibodies, I've had and I don't have the virus, I'm safe and I'm healthy. Now, that's a long way off still. While there are these antibody tests out there, they're certainly a way off from being distributed to the public. But that's sort of the gold standard. That's what would be fantastic to have. So that way you could then say, look, I've had coronavirus or COVID-19, I've developed the antibodies and I know I'm okay, but it's still too early to say, really, unfortunately.
So, Dr. Sharma, does having the antibody mean that you are not likely to be reinfected or get an infection at all?
We have no guarantee of this yet, which is why these antibody test kits, which we know for a fact are floating around illegally in Australia, are the single most dangerous medical device in our country right now. We have no proof that even if you get a good antibody response, that this response is going to last for a long time. And the other problem is, even if the test shows you've got antibodies, we haven't validated exactly how accurate it is. I want you to imagine for a second that we've got another country, Australia B, and we have these antibody tests that are 99% accurate, and we do the test on 25 million people. Even if no one in the country has the disease, 250,000 people will get the false assurance that, hey, I've got immunity. And you can imagine how dangerous that is if the disease is now introduced into that population. So it's just not the right test to be using at an individual level. It will probably have some play on a kind of survey level to see on a population level how people are responding in terms of immunity. But at the moment, it's just a bad idea when we don't even know if long-term immunity is a thing with this virus. So,
Dr. Sharma, this question asks, what are the thresholds between a mild to moderate to severe case of SARS-CoV-2?
Yeah, this is a lovely question because I think a lot of people are deceived by what mild actually means. So we actually look at the WHO's report on China, which is where this whole 80% of infections are mild and young people get mild infections come from. Mild is anything from just almost cold-like symptoms that you wouldn't even think about up to pneumonia not requiring oxygen. And that's pretty sick if you ask me. That all counts as mild. And the second you require some oxygen, then that crosses over into the at least moderate territory. So if you require oxygen, and there's ways doctors can assess this through telehealth or seeing you in GP clinic, you go to hospital, and if they put you on a face mask, a simple face mask oxygen, and you're okay, you maintain your oxygen levels, that's moderate. And if it crosses over into needing more advanced, what we call respiratory or breathing support through devices like BiPAP or intubation, where we put the breathing pipe down people's throat and there's a ventilator that breathes for you, that's what we would be classing as severe. So mild is actually much more severe than I think people imagined. It's anything up to pneumonia not requiring oxygen.
Sophie, we got another question via our website about the second week crash, as it's known, where some people become very unwell after several days of having fairly mild symptoms. For those that do unfortunately go on to die from the disease, what is the average time from the onset to the symptoms to death?
Well, I'm not sure that we can be very specific about the actual time limit, but there certainly does seem to be that pattern where people can feel okay the first week. And what's going on there is that they've got a high viral load, but the immune response hasn't really kicked in. And then what can happen in the second week is that immune response really kicks in the body. And then you can have what they call a cytokine storm, and that's when you can really start to have problems. The virus attaches to those ACE receptors that Dr. Sharma mentioned earlier. It gets into those and starts attacking the lungs and starts to, your blood pressure's affected, and you can have organ failure. So that's what's going on in the second week, and that's where, and I think that's why they were worried about the UK Prime Minister Boris Johnson, because when he started to get really sick in that second week, then they were going, oh, wait a minute, this could be a bad sign. So what can happen in that second week is people can either then obviously go downhill, get worse, or for some people, thankfully that he's young, in that younger group in his 50s, that he seems to be bouncing back. But it's when the people who are older, like in their 70s and 80s, get that second week thing going on, that's when we tend to have the real problems and the real mortality. That seems to be the pattern of this new virus.
Dr. Sharma, we got a couple of questions about whether there are some common antiviral drugs that can work, particularly in those, pardon me, those early stages. Someone asks about antihistamine. Someone else asks about the anti-malarial drug chloroquine. Why are so many people excited about that? Tell us more.
Yeah, so, I mean, I'll quickly perhaps address the histamine and antihistamines, and I've heard this often. The way to think about it is this, that when there's an infection, there's this inflammatory process that begins, and there's hundreds of chemicals that are causing this. And the initial infection is almost kind of like the first domino toppling, but this toppling of dominoes just spreads out into just several different rows. And histamine is probably one of the last chemicals to kind of fall over, and it doesn't end up causing a lot of other inflammatory changes. So just taking antihistamine is very unlikely to change the outcome. The real hype around all the drugs, everything from HIV drugs to hydroxychloroquine, I mean, it really is a lot of hype, and we're not seeing a lot of good quality evidence. What we have seen are some early studies with some flaws, and that's okay because that's what things are like at the start, that indicate we need to look closer. But unfortunately, especially say with hydroxychloroquine, I think the hype is really getting away from us, when the reality is that the answers to it are actually not that far away. There's trials that are being held in Minnesota that we'll get some good quality data from, but people are really mistaking a couple of what we call, kind of weekly positive trials that are really quite low standards and going, this drug works, when we're very used to in medicine looking at things that work in a test tube, but don't actually work well in real life.
And Sophie, the reason we're seeing so much of this information filter out is because this is such a new virus, and the studies are sort of scrambling to get some sort of indication about where this virus is headed, how it works, and that's why some of these results can sometimes seem to contradict each other as well, can't they?
And look, I think people are desperate as well. When you're dealing with an illness where there's no vaccine, there's really no treatment that works. So I looked up the guidelines of what's recommended for treatment with Australian patients who end up in intensive care. And it really just is what they call supportive care. So they don't recommend corticosteroids, they don't recommend these antiretrovirals. So that's why everyone's so desperate to find something that's going to work. And, fantastic if any of these drugs are something that is successful, that would be amazing. But we're certainly not there yet. And there's been a real flow-on effect, particularly with the drug, the old malaria drug, is that medication is actually used by people with rheumatoid arthritis and lupus. And it's used, particularly with rheumatoid arthritis, as one of the gold standard treatments. And the fact is that a lot of those patients in Australia now can't get it because people have been buying it because they think it's going to help with COVID-19. And so there are some real flow-on effects to it, which are really bad for other patients, from this overhyping of medications when there's just not the evidence. But the good news is that there are those studies being done, like Dr. Sharma mentioned. So hopefully we will get the evidence soon for those medications, but it's really not there yet.
Sophie, another question we have. If you're an asymptomatic carrier and remain undiagnosed, how long do you carry the virus for?
Well, look, that's another question that we really don't know the answer to, because those people who are asymptomatic are not really they don't know they have it, so they're not being monitored. There was a paper that came out yesterday. It was a relatively small group of patients from China, but it did seem to suggest that the asymptomatic, that there were more asymptomatic people than we thought, that the rate of asymptomatic was higher than we thought. So we really don't know. That's the problem. And those patients who don't know they have it would not be monitored, and so you wouldn't know how long they have it for. But the reality is where the 2-week period seems to be what's being used around the world. So if someone thought that they might have it and not have symptoms, then they would be quarantined for 2 weeks. Tested, you need to be tested twice and get 2 negative tests before they can say that you can go back out into the real world. So that's about the 2-week period is what they're looking at, is to say, right, you may not have symptoms, but you're okay to go out.
Dr. Sharma?
Yeah, I mean, the whole question around asymptomatic people and how much that is a driver of infection is one we're still answering. I mean, I know the study that Sophie's talking about, and believe me, the eyes popped out of my skull when I saw the numbers there. But we just don't know if that's real. We just don't know. On the other hand, we have data from places like the Diamond Princess, where it showed only 18% of people were asymptomatic, and then you've got data from Iceland showing, up to 50%. But there's real big problems with that data. There's so much lack of clarity that I think what we should do is just focus on what we know for sure, that the main driver of transmission is people with symptoms through droplets, either landing on people directly or on objects that they touch. And I'm very confident that if we pay 95% of our attention to that, we'll kind of get somewhere. The data about asymptomatic transmission, that's something that people way above my pay grade are working very hard on and will get answers on. But all we can do on a kind of week-to-week basis is just focus on what we can control.
Dr. Sharma, as we've heard repeatedly, it seems that a vaccine is at least 12 to 18 months away. Beatriz Vallador of Facebook asks, will coronavirus until then repeat each year like the flu? And what are the chances of a vaccine actually being reached inside that time frame?
So it's one of the main theories that's been posited by a lot of virologists is that something that's just going to become part of our environment, this soup of microorganisms that we live in. And look, I think it is very possible that we are going to have a vaccine. The time frame, on one hand, 18 months is an optimistic time frame. On the other hand, I mean, has there ever been a more concerted effort to build a vaccine towards a single organism? We can do some pretty extraordinary things. I wouldn't be surprised. And not to mention, vaccines are not the only form of treatment we're looking at. We're looking at potentially antibody treatments from the serum of people who've recovered and medications that might be able to mitigate things. So there are many reasons to be quite optimistic. But a vaccine looks like perhaps the most surefire population-based way to attack this. And what can I say? There's people who are working very hard on it, and if we're lucky, we'll get something sooner than 18 months.
Sophie, you're among the top people in Australia checking out all these studies on a regular basis. It's the round that you cover as National Medical Reporter for the ABC. Are you optimistic?
Yeah, well, look, yes and no. With the vaccine, when you look at what happened with SARS-1, they looked at a vaccine for that and they had a lot of problems finding a vaccine for SARS-1. So that's something that makes you less optimistic. What Dr. Sharma just mentioned about that antibody treatment was a really interesting paper that came out this week. It was only a small group of patients, but they were given plasma from people who'd recovered, and they found that those patients recovered really well. Their symptoms basically disappeared in about a day or 2 days from having this plasma. So that potentially is a treatment. So I don't think it's going to be a one magic bullet to solve this. I think we're going to be looking at, yes, a vaccine on a population health level would be amazing. But also, if we can develop some of these treatments as well, that would be amazing too. So I think we're going to need to have our fingers in lots of pies to solve this one, Jeremy.
Kelly Friso of Facebook asks this question. Even if we do develop a vaccine, does it mean social distancing will have to be a part of our social outlook, our social climate forever? Dr. Sharma?
I'm not sure, but not necessarily. I mean, it really depends on how effective the vaccine is, how much herd immunity from the vaccine we actually need. And based on that, it could be that things end up being tremendously effective, really. I wonder, though, that if the attitudes of social distancing are actually worth retaining regardless, even for, say, things like flu. Like, let's take a small example. One of the changes we've all seen is kind of working from home. I mean, if someone really can work from home, is there any reason why that should change at all, even if SARS-CoV-2 were to disappear tomorrow? So there's potentially a lot of good that we can learn from social distancing that we can apply in future too. I mean, I'm optimistic here that even the number of flu cases this year are going to drop off as a result of the social distancing we're practicing. And early on there was a question about all the deaths that occur from flu. Well, great. Is that going to be something that we can tackle through a tolerable social distancing that can become part of our cultural fabric that we aren't just enduring, but that is just normal? Maybe that's a good thing.
Sophie, there is a mental health aspect to physical distancing because it does mean people become socially distant as well and not staying in touch in the normal ways they would be accustomed to. We're now a month into the more stringent aspects of this shutdown. How are you going, and have you discovered any new tools in how to manage yourself and the ones you love, your family, and keeping them sane at this time?
Yeah, look, I think I'm trying not to sort of, be like in a prison and write the week on the wall to sort of say how many weeks it's been. I think I try to sort of just take it day by day is my mindset, even though some days it's hard to remember what day it is and whether it's, during the week or the weekend. But I think like Dr. Sharma said, there are some good things that can come of this as well. And I guess I'm trying to focus on those. I think you do need routine. I think you do need you need to be more deliberate in those ways we connect with people. So setting up like we had a trivia night with my extended family on the weekend. It was Sunday at 6 p.m. and one of the family wrote all the questions and all the family members got on. We all just answered this trivia question. So that was heaps of fun, and we're going to do that again this weekend because I think this weekend especially will be a challenge for people. So I just urge people to think about ways that they can maybe connect in another way. So whether it's a phone call or FaceTiming or setting up a Zoom call or something like that, so that way you can at least have that face-to-face connection, even if it's only for a short time, even if it's only for sort of 10, 15 minutes. Even just being able to see that person and say, I miss you, it's great seeing you, and it'll be great when we can see you in person again. Even that, I think, will make a difference.
Dr. Sharma, it is a very unusual way for a lot of people to spend a long weekend. Do you have any particular techniques in how you deal with this relative isolation and how you help those around you?
Well, one of the interesting things, and perhaps one of the privileges of being a doctor in the medical field, is that it's given a lot of us a sense of purpose, which is we've got something to fight against and, more importantly, something to fight for. So one of the huge challenges for me was convincing my parents that they need to practice social distancing. And although the kind of discussions about this were very volatile, I have to say in my family, it was an incredibly bonding experience. It really made me reflect on the things that really matter in my life. I have to say I've probably spoken to more friends and family in the last month than I ever have. And I think at least part of that is just the normalising of catching up virtually. And it probably works for someone quite well, someone like me quite well if I'm a bit of an introvert. Often, the excuse being I can't really go out because I don't really want to, whereas now the channels of communication are open and I'm happy to talk.
Yeah, I think it's it's a victory for the introverts, definitely, Dr. Sharma.
All right, on that note, we'll leave it there. Thank you very much for joining us on this live stream, and we are doing this every week, so please join us again this time next week. Dr. Vyom Sharma, Sophie, Scott, thank you to both of you for joining us.
Thank you.
Thanks, Jeremy.
Now, don't forget, we'll be back this time next week for another Q&A. Keep your questions coming in. We've received some 45,000 questions so far, and they keep rolling in. Every question is a good question. So thank you for joining us, and we'll see you again next week.